And I obviously veterans are, suffer a lot from PTSD, but there's a larger mental health crisis in our country right now, especially for young people, teenagers, a lot of whom are dealing with school shootings or active shooter threats. Do you think that there's strategies that you've learned or that you've spoken with other veterans about that maybe the wider society should incorporate, or even, sadly, kids might need to incorporate?
Yeah, I think it's simply making trauma therapy much more available to people, making sure that, insurance covers it and that it's treated no different than physical health. And because, look, like, yeah, you don't have to be a combat veteran to have trauma. Like, and you don't have to have survived a school shooting. You could, I mean, people go through bad divorces. They have problems in their childhood. They lose loved ones. They get in car accidents. They watch the news in 2022. Like, there's a lot of different things that you can have a trauma response to, and trauma is trauma. And so one thing I try and get across to everybody is that trying to rank your trauma against other people's trauma doesn't do you any good. I did it for over 10 years. And it didn't rank my trauma out of existence. It simply delayed my opportunity to deal with it and to heal. So we have to treat mental health the same as physical health. And your health plan should cover therapy. And look, we'd be a better society if more people dealt with their stuff. And a lot of people have stuff. Most people have stuff to deal with.
Mm-hmm. And I think some of our leaders have noticed this, and there's been some bipartisan support for addressing mental health. There's a new mental health hotline that was just introduced, 988. Do you think that you're seeing steps in the right direction to sort of have mental health be treated like it is, like an illness, like any other illness?
Yeah, look, I think we're definitely going in the right direction. I think we should go there faster.
Are there, I mean, you've mentioned insurance paying for therapy. Are there other things that you think could be enacted that are along those lines that would help move this along?
Well, I'll give you something that all of us can do, which is all of us can be more open about what we deal with in our mental health. You know, I wish everybody who decided to go deal with their mental health issues got the same positive affirmation that I got, which is to say, I wish everybody who did this had the chance to have people, contact you every day and tell you that, you doing that saved their life. I mean, I'm so grateful and so blessed for that, by that. But I try to get across to people that you don't have to be a well-known person to make that difference in people's lives. I mean, in the age of social media, we all live public lives to one degree or another. I mean, if all you do is you put on your Facebook profile, hey, I've been going through a difficult time since X, I'm going to go to therapy for it. Well, whether you ever hear from somebody or not, you probably will. But even if you don't, there's a very good chance you're going to give somebody else in your social orbit the permission slip that they need to go deal with their own stuff. And even if you're, mentally healthy and you don't use social media, if you just are public about it at work, if you tell a few of your close friends, I mean, that stuff spreads in a really positive way.
Sort of on